So, Mr. Brock, before we go in, do you have any comments?
Well, it's going to be an interesting morning here at the Senate Subcommittee on Healthcare. After 723 expeditions that Remote Area Medical has held, most of them in this country, and the huge numbers of patients that just cannot afford healthcare here in America. I think I'm not going to pull any punches today. I've got to tell them what it is, how it is, what it's like to be poor in the world's richest country that rates at number 37 on the World Health Organization scale of countries.
Our first panelist is Stan Brock. Mr. Brock is the founder and president of the nonprofit healthcare organization Remote Area Medical, called RAM, based in Rockford, Tennessee. He has a very diverse resume. He worked as a cowboy in the Amazon and later hosted the television wildlife series Wild Kingdom. After organizing volunteers to deliver medical care in remote villages around the world, he saw the great need here in the United States and founded RAM, which has held over 700 free healthcare expeditions since 1985. Mr. Brock, thank you for your work and thank you for being here this morning.
Thank you, Mr. Chairman and distinguished members of the committee. Welcome to America, number 37 in the World Health Organization's country rankings. I'm the voice of for more than 500,000 patients that Remote Area Medical, RAM, has treated free of charge in 723 mobile medical clinics during the last 28 years. I know what it's like to be poor and without help. I am one voice of the millions of people who are not a part of our healthcare system. They've been left behind and forgotten, and I speak for them today. I came from a place where there was no doctor, living with the Wapishana Indians in the upper Amazon. Their only recourse when faced with catastrophic injury or sickness was a tribal witch doctor, but at least they had that. Some of the sick that we see here in the U.S. have nowhere to turn. That is why I created Remote Area Medical. When I suffered a serious injury, one of the Indians said, "The nearest doctor is 26 days on foot from here." I felt then what so many in our nation feel today when they need a doctor and cannot get care. For millions of Americans, they might as well be 26 days on foot from the nearest doctor. In fact, one of our patients recently walked 15 miles because he was desperate for medical attention. Healthcare in America is a privilege of the well-to-do and the well-insured, but leaves about 50 million people flat out of luck. These families live in fear of injury and sickness with no insurance or not enough of it. The predicament of these millions of marginalized Americans raises questions of morality, injustice, and education. Poor education begets poor health. Poverty feeds on poor nutrition, which creates obesity, diabetes, heart disease, and cancer. The vicious cycle lies in wait for each child slaved under the security, as they pass from beneath the security of state and federal programs into the barren wastes of adulthood. Many nursing mouthfuls of decayed and abscessed teeth or suffering from fading vision will inevitably join the long lines of desperate patients at a RAM-free clinic. I've looked into the distraught faces of Americans imprisoned by poverty, from child to grandparents, all generations lining up by the hundreds in places as diverse as Los Angeles or a fairground in the mountains of Southwest Virginia. I've seen our elderly in makeshift wheelchairs, people clutching precious numbered scraps of paper, their RAM-free clinic ticket to relief from unnecessary agonizing pain and sickness. They cannot afford health care. This leads some of our American families with their children to sleep in tents and cars, often for over 24 hours, waiting for a RAM event to open its door. Blindfolded, you can stick a pin on a map of America, and wherever it lands, you'll find hundreds, if not thousands, of sick, hurting people in need of care that they cannot obtain. Our people are living in sickness and pain and in need of basic medical attention. At RAM clinics, dental care is the greatest demand, with vision services a close second. 85 million Americans do not have dental insurance, and half of those cannot afford to pay for a dentist without it. What are they to do? Hospital emergency rooms don't do dentistry and they don't make glasses. In most cases, Medicaid does not cover dentistry or vision for adults, and finding a Medicaid practitioner to provide treatment can be a real challenge. RAM is not a solution to the American healthcare crisis. We need to be in places like Haiti, not Tennessee and California. RAM bridges the gap for those suffering needlessly in our system. A RAM event is logistically strained at 1,200 patients a day, and we are forced to turn away hundreds and sometimes thousands of sick people. Our healthcare system has failed our people because they either do not have access or they cannot afford it. As a result of the great need of those who are sick or injured, we have reached out to legislators for help. In 1995, RAM asked the state of Tennessee to change the law to allow out-of-state licensed practitioners to provide free care to underserved patients in Tennessee. This highly successful program attracts 60% or more of the medical volunteers at RAM events from out of state. A total of 12 states have now adopted the Tennessee model, but this process has taken 20 years. Doctors are still calling me to say that it's easier to volunteer their services in places like Guatemala than it is here in the United States. I have two pictures here that I'd just like to hold up as an illustration that in this 1936 picture of a Depression-era mother in California, is it any more revealing than this 2012 picture of 1,000 Americans holding up their hands, appealing for health care before daybreak at a RAM-free medical event in Bristol, Tennessee? Where have we gone wrong in the last 76 years that separates these two iconic images? Thank you, sir.
Thank you very much. I'm going to pick up from where Senator Warren left off by suggesting that as a nation, we spend a lot of money on health care. We really do. We spend almost twice as much as do the people of any other country. And yet, we heard from Mr. Brock that all over America, you have people who are desperate, who are spending their nights in a car to try to get their teeth pulled and so forth. Let me ask you this. In terms of money, if we address the crises of primary health care, we heard that we need some 50,000 new primary care physicians by 2025. That's going to be an expensive proposition. But here's my question. Do we save money or do we waste money by investing in primary care? Is this, in fact, a good investment, or should we see it as just another expenditure?
I think we're talking about a loss of productivity here amongst these people. The age group of the people that we see is predominantly between the age of 29 and 64. We're only seeing 2 or 3% children at these events. And so we're talking really about the workforce. And all of them, although they may be there primarily for dental care and vision care, all of them are really there in great need of basic medical care as well. And particularly, I might add, mental health problems. And we could hold one of these RAM programs every day of the year and see 1,000 people without a doubt. And so it's an incredible loss of productivity.
Good. Let me ask you this. If there was an understanding here in Congress of what you all just said, that investing in primary health care not only keeps people healthier but saves money, and if somebody said, you know what, we need 50 or 60,000 new primary care physicians by the year 2025 and looked at it almost from a military perspective. All right? We got a mission. We got to accomplish that mission. How do we do it? How do we do it?
It's a question of opportunity. And just because boys and girls maybe come from a minority group or underprivileged group doesn't mean to say they're not bright and that they couldn't meet these academic standards. And in my case, I came from an underprivileged home back there in England. And but I was a fairly bright kid, I think, and I was told that there was an opportunity to go to one of Britain's finest schools if only I could pass the examination to get there. And so I worked hard at the books, and I took that examination, and I went to one of the finest schools in Britain, totally free. Books paid for, everything paid for. And I could have gone all the way to university and all the way to become a doctor at no cost. I'd like to see some kind of a program for these underprivileged kids here. I didn't take advantage of mine because I ran off to Brazil to become a cowboy, but I could have become a doctor, and it would not have cost me a nickel.
The hearing went.
Well, you know, it was a very good hearing, and the other members of the panel made some very good points. I think one of the interesting things that came up, I raised a question at the end there of this tremendous resource of people that are from whom we get no productivity. These thousands and thousands, indeed millions of people that line up for free health care. They don't have jobs. They're in terrible physical shape. And so fixing the healthcare system so all of these people can have access to healthcare will potentially put them back in the workforce where they belong. That group of age 29 to 64 is a lost resource to the United States of America.